2. Good afternoon. My name is Arlene Midward. I'm a licensed practical nurse. Today, I would like to talk about ethical, legal aspects of overdosing patients. Nurses are trusted with responsibility to administer medication safely and advocate for patient well-being. However, intentional or negligence overseeing the patient may represent a serious breach of professional ethic, legal standard of patient trust. In clinical setting, an overdose occurs when a patient receiving more medication than it was uh, prescribed by the medical provider, either accidentally or intentionally. Some common substances are involved: opioid, substance, sedative, insulin. I would like to give some example. Like I would say sedative. Like a patient supposed to receive 0.5 lorazepam, and the nurse did not look at the mark properly, or was in a hurry because she have a lot of patient for that day, and administer 5 milligram of lorazepam. This is a med error. This is accidentally. Also, a patient that's also receiving insulin, the nurse supposed to give 2 units and administer 20 unit by accident. This is an accident med error. And some nurses, if a patient did not sleep or don't want to sleep, they will administer medications that they wasn't prescribed for the patient to sleep. This is intentional that I'm talking about. The intentionally give medication just to ease the assignment, which should never happen. Some can say the causes are inadequate staffing or burnout nurses. Ethical violations are the patient trust and the decision. I would like to elaborate on inadequate staffing. Like I said earlier, for example, our nurses have 40 patients instead of normally 30 patients she usually have due to a nurse call out. Something happened, and they have 40 patients instead of 30 patients for that day. And they don't know the patient well, some patient well, and they're in a hurry. They administer medication in a hurry. That can cause medication error. Or if they don't know the patient and they don't bother to check the identification, like the name tag, the room number, the door. Some nursing home have pictures of the patient in the mark, and they just administer medication. We can say it's either accidental or intentional. Some legal action can be taken: criminal charges, loss of nursing license to the board, civil lawsuit from the patient family. What preventive measure can be taken? The use of what preventive measure that can be taken? You can use 2 identification, like I say. Double check the patient room, double check the patient armband, double check the patient mark. Like I said, sometimes they have picture. You can look at the picture to make sure that's the right patient you administer the right medication to. Because in a nursing setting, especially in a Alzheimer unit, patient go to patient room all the time, lay down in a patient room, and you never worked in that assignment before, and you just went in and administer medication without checking the proper handband, and this is a medical error. Also, they can have more training and adequate assessment. Some conclusion that I can make is nurse hold a vital role of safeguard life when overdosing occur, whether accidentally or intentionally. It is devastating consequences for patient, family, and healthcare system. Addressing the issue to better training legal accountability. Ethical vigilance is essential or prevent trust and show patient safety. Like I say, patient is, when you're giving medication, make sure you have the proper patient, the proper room. If you have to look at the mark a couple times, do so before you administer medication. Don't just assume. Thank you.